Why your doctor missed this. I want to be clear. I respect doctors, I work with doctors, and many of my patients are referred by their physicians. They are brilliant at what they're trained to do. But here's the truth. They're trained to diagnose disease, not prevent it, not to find the root causes of dysfunction. And there's a massive difference. Here's why your doctor missed it. Medical school trains doctors to diagnose disease, not dysfunction. They learn pathology, what happens when something is broken, but they don't learn what happens in the grey zone, when your body is starting to break down, but hasn't crossed that threshold into disease yet. Secondly, your doctor is time limited, 15, 20 minutes if you're lucky. They have to take your history, examine you, order tests, write a prescription. There is no time for them to investigate root causes. There's no time to ask about your stress, your sleep, your gut health, your trauma, your spiritual life. And also, insurance. It doesn't reimburse for prevention. It reimburses for diagnosis and treatment. So your doctor gets paid to diagnose your diabetes, not to prevent it. They get paid to treat your depression, not to investigate your neurotransmitters and your dysregulation. And finally, your doctor is trained to use a very specific toolkit. And these are excellent. Medications, surgery, imaging, blood tests. But they check if you're already sick. They're not trained to look at functional markers, the early warning signs that something is going wrong. Let me give you some specific examples. Your doctor checks your fasting glucose. It's in the normal range, but at the top end. And they say, you're fine. But functionally, anything already in the top end of that range indicates insulin resistance is starting. You're in the grey zone. Your doctor can't see it because they're using disease diagnosis ranges, not functional ranges. Your doctor checks your cholesterol. They use conventional ranges. They don't check your inflammation markers, your CRP, your homocysteine, your omega-3 index. These are markers that actually predict heart disease. Your cholesterol could be normal while your inflammation is through the roof. Your doctor doesn't test your microbiome at all. They might culture your stool if you have severe diarrhea, but they don't look at your bacterial diversity, your beneficial species, your pathogenic overgrowth, like E. coli and strep. They can't see your gut dysbiosis because they're not looking for it. Your doctor doesn't test your cortisol patterns. They don't check your thyroid antibodies very often. They don't measure your D, B12, iron stores. They don't look at neurotransmitter precursors. They're not trained to investigate the functional markers that drive symptoms. Here's the fundamental difference in how we think. Conventional medicine asks, what disease do you have? Then they treat the disease. Functional medicine asks, why do I have this symptom? What's driving it? What broke down to create this dysfunction? Your doctor sees the headaches and prescribes a migraine or headache medication. They're treating the symptom. I see the headache and ask, is it insulin dysregulation causing blood sugar issues? Is it chronic inflammation? Is it dehydration from poor kidney function? Is it unresolved trauma stored in your nervous system? Is it a nutrient deficiency? Is it your gut dysbiosis triggering neuroinflammation? The root cause determines the solution. If your headaches are from insulin dysregulation, a migraine or headache medication is not going to fix it. You need to stabilize your blood sugar. If it's from gut dysbiosis, you need to heal your gut microbiome. If it's from trauma, you need to process the trauma. Your doctor isn't trained to think this way. They're trained to diagnose and treat disease, not to investigate root causes. By the time your doctor diagnoses you with something, you've usually had the underlying dysfunction for years, sometimes decades. Think about type 2 diabetes. On average, people have insulin resistance for 10 to 15 years before they're diagnosed with diabetes. For 10 or 15 years, your blood sugar's dysregulated, your inflammation rising, your gut is becoming dysbiotic. Your hormones are chaotic, but they don't know it. Their doctor doesn't know it. Then one day, your fasting glucose crosses the threshold. You get diagnosed with diabetes. Now your doctor can start treating it. The damage is done. The neuropathy has started. The kidney damage has started. The eye damage has started. If we'd caught it 10 years earlier, when the fasting glucose was starting to climb, we could have reversed it with lifestyle, medicine, but conventional medicine doesn't work that way. It waits for disease, then it treats disease. I think differently. We look for dysfunction. I'm catching it early. I'm reversing it before it becomes a disease. And here's the biggest gap. Your doctor treats your body as separate from your mind and your spirit. They're not separate, they're integrated. Your stress affects your gut. Your trauma affects your hormones. Your lack of purpose affects your immune system. Your disconnection from something greater affects your neurotransmitters. Your doctor doesn't ask you usually about your stress, your sleep, your relationships, your purpose, your faith, your spiritual life, because they're trained to treat the body as a machine separate from the mind and spirit. But healing doesn't work that way. True healing requires addressing the whole person, body, soul, spirit. I am not saying your doctor's wrong. I'm saying they're trained for a different job. They're brilliant at diagnosing and treating disease, but they're not trained to investigate root causes. They're not trained to work with functional markers. They're not trained to think about the whole person. This is where you come in. You want to know more. Ask your doctor for more bloods, more pathology. Find an integrative or functional doctor who will investigate root causes, address the whole person, and start working at becoming healed and whole. Click on the link in my bio to download my free guide, The Root Cause Reset. It's the exact framework used in my clinic to help people start reclaiming their energy and health, especially when they don't know where to start. It shows how to start looking for root causes, but it also covers what kind of tests you might want to consider investigating with your doctor. It's only a guide. It does not replace current medication or treatment that you're already on with your doctor. But at least you'll be looking in the right direction and starting the process to being healed and whole.